set and joint carers lead network meeting, because we were having them separate, but it seems to be working out having them sort of joint. So that's why we're having the longer sessions at the moment. We have got a lot to get through today. So our first guest that we'll have this morning is Jo Best, who is our hospital services coordinator. And Jo will be sort of talking about her team and the support they provide to carers within the hospitals. And she'll give a bit of information about the hospitals where they're actually based and about the discharge process and the support at home after hospital service, a little bit of information about that. Then we'll have Rachel Brett from Limetree Surgery going to have a little chat with us, a little interview, and talk about, this is Spotlight Surgery, so just talk about some of the work that she's been doing and things that have been going well and how it sort of worked with the project. And then I'll hand you over to lovely Anna, who will give an update. And then the favourite part is to ask every one of you kindly do a poll for us before you leave at the end of the day. So without further ado, I shall get the PowerPoint up ready for Jo, and yeah, let's hope things go okay.
I hope so too.
Of course it will. Right, let me just share. Bear with. It's loading something.
Good. Excellent.
Can everyone see that?
Yes.
Yeah. Okay. Over to you, Jo. Thank you.
Thank you. So a quick introduction. So, as Micah said, I'm with the hospital team. Carers Support cover county-wide, plus because the hospitals go to the trust also takes in Royal Sussex County, and we cover East Surrey Hospital as well. So we did have a larger team, and with the last re-tender, the hospital team has become smaller, and we're having to concentrate our work on those carers within the hospitals who are really struggling. So the work has become more concentrated, more complex, but working very well because the carers who need the support are hopefully getting the support. Our referrals come in from hospital professionals or the carer themselves saying, we need a hand. The vast majority of our referrals will come from occupational therapists. Right, can we have the next page? Just to give a quick. So, on the ward, a lot of this would be covered in telephone conversations where we would talk to a carer and say, please explain to us, what are your concerns? What are you feeling is challenging? And a lot of it is lack of communication. And this is a theme at the moment that seems to be increasing, where carers are they're getting confused because they're not sure what the processes are, what the next bit will be. And it may be just as simple as explaining to a carer that when they hear that their person that they have in hospital has been medically discharged, it doesn't mean they're going to be coming home. It means that the doctor has said, right, we're ready for the next team to take over. And so that would be physiotherapists, occupational therapists, etc. And then they in turn will refer it to another department. So at the bottom of this slide, you'll see is the approaching end of life. We are also getting an increase in end of life support. End of life can be anything from hours to months. In a couple of cases, we've had a couple of years. So it's having a look at what the immediate needs of the carer are and then working with the hospital to try and make sure that they have the right information on hospices, what care may be available at home. And this has brought up challenges because there has been a lack of people to provide the palliative care at home. And so there are more people probably having to stay in hospital to die rather than, as they would prefer, go home. Can I have the next slide, please, Mike? Okay, so expectations. Expectations for people when they come into hospital and for the carers supporting them are that everything will be identified quickly, that they will be told what they need, they will be nursed in hospital until they're ready to come home and carry on as normal. And this, again, is not always the case. So because they are acute hospitals, they are dealing with acute situations, and the people who are in the hospital are meant to be there because they need to have something medical seriously sorted out. That doesn't mean that people, once they get to a point where it is just rehab, that they can't be transferred from the hospital to a community hospital where they will then carry on with their rehabilitation and get home. Once again, the challenges for that are the fact that there are shortages. You have to wait and see which community hospital you can get into. And in many cases, although they will try and respect preferences, the system at the moment is if somebody in Bognor Regis says, they say, right, you need rehab, we'll put you in a community hospital, and the next bed comes up in Horsham. Horsham is where they'll go. There is not a choice at present. Right, next slide. And so we can leave you to look at these at your leisure. I think the important thing is what connects the primary care with the hospitals. So the guidance, helpful guidance, is making sure that carers and patients understand the process they are going through and what will happen next. So we would quite often say, you need to speak to the occupational therapist, you need to speak to the physiotherapist. And by speaking to the right people, they're getting the right answers. So next slide, please, Mike. Okay, so in the early stages of the hospital service, and when there were more of us, we would be trying to get in touch with the carers and the patients early in the process so that we could help them plan what was coming next. With the latest contract that we have, the emphasis is being put more on the discharge stage. And so it's as people approach the discharge from hospital that we are becoming more involved and trying to help them plan and know what they are going to do once the patient has left. A lot of issues for carers might be, although on a ward, if somebody might be deemed independent and therefore going home without any package of care, that would be decided by perhaps they can walk to a bathroom in the ward with a walking frame and assistance of one. That would make them independent and they'll be sent home with no package of care. So it's really talking through with the carers and the patients that if they have any concerns about it's going to be like at home, perhaps they have carpet at home, which means walking with the walker isn't going to be as simple as doing it on the ward. There may be issues with how wide the space getting into the toilet is. Will a walker fit? Can they walk into the bathroom? Are they going to need a commode until they have more mobility? So there are all these things coming up to discharge that really need to be discussed and planned. Okay, and the next one. Thank you. So the common discharge outcomes, and these are when people are on a ward and they've been medically discharged and they're seeing the physio and the OT, where it's decided they're independent, which, as I've just described, means can they get to the bathroom on their own, they will just be given a discharge date and sent home. When they're sent home with UCR, which is urgent community response, the package of care only lasts up to 10 days. And it does say on some NHS sites that there's up to 6 weeks. It isn't. It's up to 10 days. During that 10 days, the carers that are going in during that period will assess the patient's needs and then report to social services with an assessment and say, right, these people really need 3 times a day care, or they need once a day in the morning to get them up. So that recommendation, then the social services will do a financial assessment and put the ongoing package of care into place. And privately funded, which is often a problem, is the patient and the carer may need assistance, but if they are have funds in their savings of over 23,250, then they are deemed to be self-funding, and they may need care, but they have to find the care themselves. They can ask for assistance in identifying suitable agencies, but they will be paying for that care right from the beginning. So yeah, it's challenging for some of the self-funders. Right, re-enablement, this is up to 6 weeks, and this is where a referral is made so that it may be a physio coming in, it may be a community nurse coming in to change dressings, it may be an OT. It's a case of they feel that when you get home, you are going to continue to need support in your rehab, but you can do it at home, but they will put somebody coming in once a week to do that. If at any time during that 6 weeks they think, oh, you don't need us anymore, it won't last as long as that. Placement, everything is described as short term. So even if somebody's going to be going into a care home permanently, at the beginning it's described as short term because they have to see, is it the right home? And they have to be assessed by the home they're going to go into before they leave the hospital. And this brings in quite a lot of the dementia patients. So quite a lot of people who will be ending up going into placement from the hospital are where dementia has increased and the carer can no longer take care of them at home. So this, again, very fraught time, lots of guilt, lots of the people who are going into the care homes don't want to go into the care homes. The families are feeling incredibly guilty and pressured, but in some cases, maybe because they wander, maybe because they can't remember who the people they live with are. Some people, depending on the type of dementia, might become violent. So there are situations where placement is going to have to be the answer, and we do a lot of supporting of carers who are having to go through that journey, and so much guilt involved. And right, common discharge continued. End of life. We have had an increase in end of life referrals recently. This is mostly emotional support. So we do help with, we have a very good benefits advisor with Carers Support West Sussex as part of the county-wide service. We have recently been looking at assistance with paying for funerals, carers accessing other services. We no longer have our counselling service, so for some people they do ask for recommendations to other agencies. So the carers that come to us and get assistance in the hospitals at the moment, the two things that we would be doing mostly would be real practical assistance in making sure that they're talking to the right people and providing emotional support, because for many this is just a very difficult time. Now, that is our discharge process and our hospital service. But with the new contract, the hospital service has become part of a health team. I think we could lose the PowerPoint now. Thanks.
Jo, before you go on
yes.
to hiya, before you go on to this next section, I just wonder, would you be able to just give a little bit more information about which hospitals you're currently supporting?
Absolutely.
Yeah, and there was a clarification question where Jo and the team are part of Carers Support West Sussex, and they're funded through our core services, but they have been they're a long-term service that have got very integrated relationships with hospitals and work out of hospitals. So just to clarify that point, and perhaps Jo, if you could say which hospitals you work with in particular. And I know that things have changed in terms of you used to be more based in the hospitals, and you still do that work, but there you also work remotely at times as well. So perhaps if you could just cover that off. And I know you mentioned also about referrals into service, but it might be nice to give people an indication of some of the, where some of those common referrals come from within the hospital as well. That would be fab. Thanks, Jo. Thanks.
So, hospitals: St Richard's in Chichester, Worthing General.
I didn't come in till 9 this morning. I was late.
Hello, can I just make sure everyone's got their microphone off? I think that's Julia, is it? Oh no, Julia's is off. Let's just check everyone else's is off. Okay, great. And I saw people immediately start to write notes on which hospitals you are based in, but we will very happily add that to the PowerPoint presentation before it gets uploaded onto the toolkit. So, feel free to or not to. And maybe, Jo, if we pop it into the chat afterwards so people can make a reference.
Not a problem. Not a problem.
Fab.
Okay, so acute hospitals, say St Richard's in Chichester, Worthing General Hospital, Princess Royal at Haywards Heath, and then as part of the trust, although it's not in West Sussex, Royal Sussex in Brighton, and also not in County, East Surrey Hospital. Now, the reason we cover Brighton is because the trust expanded and it comes under the same trust as St Richard's, Worthing and Princess Royal. But East Surrey and Brighton, actually, 40% or so of the patients in those hospitals are West Sussex residents. So as long as the carer or the cared for, as long as one of them is resident in West Sussex, we will support. We have carers as far away as Australia. It doesn't mean we can't act on their behalf, mediate, liaise. This is to support the person getting home from hospital. Then community hospitals. We cover Bognor, Arundel. We count Donald Wilson Rehabilitation as a community, though it's part of St Richard's. Zachary, Merton and Salvington Lodge, though one of them is closed at the moment. Kleinwort, Horsham and Crawley Hospital, Community Hospital. So we have in total 5 acute and 8 community hospitals. We do not take referrals to the hospital team from mental health hospitals. So those go straight to our helpline, and they are supported. They just don't go through our hospital team. Our main referrers within the hospital are occupational therapists, followed by social workers, discharge coordinators, ward staff, doctors, consultants, anybody who is talking to a patient and their family who thinks they're going to struggle would quite commonly put in a referral to Carer Support and just ask us to reassure and explain what is going on to the carer. We've had an increase in referrals as well to do with drugs and alcohol. And we can only really give advice because most of them are coming in through A&E. So if you're not admitted to the hospitals, we will certainly provide information, but we don't support generally within the hospital for people who are not admitted. That is changing slightly because, and this is my next part of my point, is that because we are working in the hospital and change our systems, the NHS is constantly changing and the hospital processes are changing. So at the moment, there's a big push to try and stop bed blocking, get people home as quickly as possible, get them into community hospitals as soon as possible. Now, in the hospital service, we would generally refer to Vida, because then Vida can come in and provide emergency respite, care, etc. And another big referrer for us would be the Carers Health Team, because Carers Health Team will be a face-to-face meeting. You can go into that carer's home and see how they're coping, looking after the patient. They can then expand other forms of support to that carer, and they have the useful fact that they are connected to GP surgeries. They can report to and put reports into GP surgeries. Various community services have been being trialled in the acute hospitals. So there's an in-reach practitioner who is sitting at a desk getting people into the longer term, the rehab beds. And this is, as I say, if there's somebody who lives in Bognor, but there's a rehab bed in Horsham, that person will go to Horsham. Hopefully, as the pressure on the services lessens, people will have more choice, but at the moment they really don't. The UCR, Urgent Community Response, has been piloted, working within the hospital setting, so that they can do assessments in the hospital about getting people home with the up to 10 days care. That is continuing. Then there's virtual wards where people can be nursed if necessary. If they don't need to be in an acute hospital, they're not ready for rehab, but they do need assistance with medical care at home, they can be referred to the virtual wards. It used to be just cardiac conditions, but now they'll take any condition. The fact that there's just so much for a carer to get their head around, that just recently, and I know I will have sent little mini reports to some of your GP surgeries, people get discharged without the right information, without the right referrals. So a situation that I've been helping with recently was where a gentleman was in A&E, he had had a fall, he couldn't use a bottle on the ward, so he was given a catheter, and then during the night, he was discharged, went home, and they've struggled ever since. The fault was with A&E. The appropriate referrals were not made for this carer. They did not get the referral made for someone who should have gone along in the morning and taken the catheter out. They did not have any referral that could look at equipment they needed. They didn't have a toilet raiser. They didn't have a frame around the toilet. He's a falls risk. He's got a UTI. And when the carer, who's a very proactive, clued-in lady, started phoning round who she thought she should speak to, including GPs and whatever, she found she wasn't actually getting the answer to her question. And that should have been that, because if A&E had given the correct referrals and sent that carer out with a telephone number about who she should ring to get sorted, none of that would have happened. And we're getting an increase in people falling through the gap, where the hospital are trying to get people out promptly without an admittance. And this is, for me, where I'm feeling really passionate about this at the moment, is, oh, I know Freddie Jones, I've just so this is where we need to build. From my point of view, we really need to increase our good relationship with the GP surgeries, with the carers leads, with the social prescribers, with everyone, because I think this is going to increase. The way the hospitals are all going at the moment and trying to avoid people who don't need to be in the hospital, and they're quite right, they don't need to be in the hospital, but there is a gap at the moment between the smooth transition between coming out of a hospital and being at home safely. There are too many people getting in touch with us and saying, I don't know who I'm meant to talk to. I don't know what I'm meant to do. And this is where talking to a carer lead or a social prescriber or whatever at their GP surgery could be so valuable. My plan at the moment is I am going around the teams within the hospital discharge situation. The hospital has produced, each hospital has an individual one, a welcome to whatever the hospital is, and in that booklet is all the information they need, all the ways of accessing support, but they're not using it. So I'm at the moment running around with this booklet going, here you go, when you discharge someone, can you give them that booklet, and can you write who they should be contacting if they face a challenge in that booklet? And then when people go home, they can get their booklet out and go, okay, I need to ring one call, or I need to have a word with my GP surgery, or whatever. Another challenge for that discharge point of view is that medical notes don't get transferred straight to the GP surgery, and so GP surgeries are unaware of actually what's going on for the patient. Plus, and this is the urgent community response lady mentioned this to me, is that when they're sending the report on medication from the hospital, they only put on that report changes in medication, not the whole picture of medication. And so it can be really misleading for the carer, the patient, everybody, when they get a list of their medication, but it's only what was changed at the hospital, not a bigger picture of their the medication they were in before. Yes, Mike, you've got your hand up.
Hi, Joe. I don't know if you would have seen it, but Melanie has just asked, can they get access to a copy of that booklet at all that you mentioned at the hospital? Is there a way the surgery could get access to it at all?
Absolutely. We'll get something sorted where we can. I yesterday spoke to the person who provided them to me and said, look, I need more for different hospitals. So we've only got the digital copy that we could send out of the East Sussex booklet. But each hospital, so there's one that says welcome to St Richard's, one that says welcome to Worthing, and because they're done individually simply because the local numbers and who you need to call will be relevant to somebody in that hospital. So I will get some together and give them to Mike, and
Thank you.
hopefully Mike can distribute them to you so you can have a look. But we can share the digital copy of East Sussex one, which gives you a general idea. Right.
Thanks.
Petra's also got a hand up, Joe, so you might want to take
Yes,
that
and I was going to
question.
say there's one about
Yeah.
Gail there, but I'm not. Right, okay.
You're on mic,
mute.
Petra. You're on, yeah.
Thank you so much for all of this information. It's really invaluable. Scary a little bit.
It is a bit scary at the moment.
But when you mentioned that each of the booklets has got slightly different telephone numbers depending on what hospital the patient is. So if they are from Worthing or Shoreham and they're at St Richard's, would they still be calling the telephone numbers based on St Richard's Hospital, or the ones that the service is actually local to them?
Okay, so they will get the booklet from whichever hospital they happen to be admitted to. If they were then at, it's a good question, and I honestly, nobody else has asked me that. So the Worthing one, they could certainly, for example, call into Carers Support, or if the surgeries have a copy of the booklets from each one, and we can provide the appropriate number for their area. But I feel that with a lot of the numbers, if somebody at St Richard's rang a local number and explained where they were living, that source should be able to just give them the appropriate telephone number. And there are some services like Adult Care Point. All calls come to Bognor. So because that's where the people are sitting on the phone answering Adult Care Point calls. So yes, a lot of things will be county-wide, but there are some things that will be local, and the local one, if you rang on the St Richard's booklet, should be able to tell you what the Worthing equivalent would be. And I've just realised there's something else I haven't mentioned, and they'd shoot me. Is our Home After Hospital service, which we do in partnership with Age UK. Age UK support those patients living on their own, whereas the carer support side of things, we took on the role that the British Red Cross had previously covered, and that is where the carer lives with the cared for. So we are looking at it from the carer point of view, but looking after the cared for. And Age UK would be doing it where the cared for lives on their own. That is regular contact up to 6 weeks after hospital discharge. And that is so useful because the people working in it have so much experience in what people need when they go home. They've both been involved in that side of the work, and so they are very good at saying, okay, so have you spoken to Pat, the prevention assessment team? Have you spoken to the carers health team? Can we look at possible funding to help you if you're struggling with utility bills or so on? So that's say weekly phone calls for up to 6 weeks. And then also I've mentioned it a couple of times, but it is so valuable. We have a benefits advisor who will look at, do people need attendance allowance? Do people, would they be able to get pension credit, etc., etc. They have saved literally millions of pounds for carers who aren't getting the support they should be getting. Right, have we got?
You see,
I couldn't
let's
see
have a
who the
look.
hand
Was it
was.
Sarah's got a hand?
Ah,
Sarah.
hi, Sarah.
Oh,
Yes.
Hello, morning everyone. This is invaluable. Thank you. Funnily enough, this week I've also been speaking to because I'm in East Grinstead. We're in East Grinstead, so we touch Surrey as well as
Yes.
East Sussex. And this week, interestingly, I've been liaising with Action for Carers hospital lady who is Stacey Holman on this subject. So this is really timely. Thank you.
Yes.
And I don't know whether you kind of work together on some of the things, but there's a carer's passport. My understanding is, and the hospitals and websites are not very helpful, and they seem to have changed, that there's a carer's passport, which my understanding is that they can get help with parking, and visiting outside of regular hours if
Yes.
they, so that's the other sort of benefit. The reason I got in touch with Action for Carers is because although the patients registered in West Sussex, they were at hospitals outside of the area, and at the
Yes.
time I was like, don't. So I'm guessing at the end of this you'll let us know how we can make contact or how we can refer.
Okay, yes, of course. But just
Please.
on the passport point, the reason it's quite hard to find information at the moment is that this is a very new change. We have a lovely lady who's come in, the head of nursing for dementia, Katie, who came in and revised the passport for the 4 hospitals under the Trust for University Sussex Hospitals. So there was one that worked in St Richard's and Worthing, which gave really big advantages for people coming in and looking after people with dementia. They have now taken the passport and made it uniform across the 4 sites. So St Richard's, Worthing, East Surrey and Brighton. And it is very much based, Princess Royal and Brighton. It's very much based on the one they're using at East Surrey. So actually, all 5 of the acute hospitals that we're working with have a similar passport now. And I've been looking online as well. I can't find it. They haven't put out the sort of new passport information properly as yet. I think it's because it has just been changed. So at present, if by getting a carer's passport, what you would get would be a reduction in your parking, be able to have more flexible visiting time on the ward, and you can have something off the tea trolley, like a cup of tea, cup of coffee, some biscuits. It used to include a meal, it no longer does. People were bringing the whole family in and feeding them. So they said, no, we're not doing this anymore. It's still something that you negotiate with the ward about what time you can be on, but where there really is a need, you could be there 24/7 on the ward with the carer if, say, it was somebody who was really distressed, unless they had a family member there or end of life or whatever. Now, the passport works that way, but also if there is a situation where somebody's been in hospital for a while and it is maybe end of life, you don't have to rely on the passport. The ward would give you a form that you could fill in and you won't pay anything for parking. Okay. So there are things in place outside the passport that might be more appropriate than a passport that gives you a reduction in some of the things.
Okay, fair, thank you. Can I just, before my experience as well was when I realised, because as I say, this has only happened over the last sort of month, these changes have been on their website, and I'm talking about East Surrey here. So I know so I rang East Surrey and said, oh, I can't seem to find information about the carer's passport on your website. And I was immediately said, oh, we'll transfer you. And they transferred me to Surrey County Council, because the reception team and the team at East Surrey, it seems like it's not clear that they know about this particular resource. So I said to East Surrey, to Surrey County Council, can you have a chat? Can you have a conversation with the hospital? Because obviously they don't want those phone calls. And so I just wanted to let you know just my experience really there.
Thank you. And we do have meetings with SAHAH up at East Surrey Hospital, and we do, because we've got somebody who's been on maternity leave. They get back next week, and so we will have a body in East Surrey, which will make life a lot easier. We have also set up partnership, because for me at the moment it's all about good partnership work and communication, because one person changes a service, it has a knock-on effect with everybody else. I think we all need to be talking about it, so that you know, we're not blindsided by somebody coming up and going, oh, I'm struggling with this, and we don't know about it. So the more we share, the more we talk about this, the better it's going to get for the carer and the patient. And so we've already had partnership meetings with Care for the Carers in East Sussex, and we set up a quarterly meeting. But we have had already a case where they've said, we've got someone in Princess Royal. They live in East Surrey, East Sussex. Sorry, they don't have any connection with West Sussex, but they're in a West Sussex hospital and they need help. So we did it. So. And that emails went backwards and forwards, so we knew what they were doing for the carer. We told them what we'd managed to arrange with the hospital, and so it was a very successful bit of partnership working. We've also, in that same group that we're linking up with, the Brighton hub has also joined that. So it's the Brighton hub, Care for the Carers in East Sussex and Carers Support West Sussex are having regular meetings and going, okay, we've got a problem. What do we do about this? What do we do about that? So lots of really good partnership stuff coming up.
And Jo, I wonder if it's I know you touched upon it earlier, but you know, not necessarily through anybody's fault, but you do have lots of situations and circumstances where a person will be discharged from hospital and there's a lag or a delay in information in the primary care setting, receiving information about their updated medical situation, or even knowing that they've been admitted to hospital. Yes, and I think you wanted to kind of talk about, you know, perhaps how channels of communication or even get advice from the carers leads and social prescribers we have on the call today about how you know, how we could improve that connectivity because sometimes that lag is a reason for which an individual is going to become more vulnerable and potentially end up back in being readmitted into hospital also.
So yes, I've sort of been, I'm keeping my fingers crossed, Anna, and you'll know what I'm going to say about the dashboard at the hospital. I'm hoping that before too long, there will be a system where GP surgeries will have quicker information, and it's something that,
should we just Jo, should we just actually just give a little bit of more information on the TOC dashboard, because I'm not sure everyone here will know what that is, so it might be worth, because then they could actually potentially ask at their own surgeries any comms that's gone out around that at this stage, because I'm not sure what there will be.
No, and I don't think it's sort of out there in a lot of places at the moment. There's a transfer of care hub. The task and finish groups are working at the moment, so it doesn't go live until November. We've had it was going to be October, it's been delayed, it will now be November. The purpose of this is to have something on the screen on the ward that is a discharge planner for each carer, each patient, sorry. And we do have a box on there that says information about family and friend unpaid carers, so that if somebody was going to struggle, we can have it on there. But the point of this is, if you're on a pathway 1, 2, or 3, they will be watching how this is going. So the first pathway would be somebody who's going home with UCR, the urgent community response. The middle section would be no, in fact, the first one, my mind's gone blank here. It's the degrees of support they need when they're going home. Number 3 is being put into placement. Number 2, that's it. Number 2 pathway would be rehab, and number 1 would be going home with some support. So if somebody, as soon as somebody comes on the ward, they will start planning. So they will be putting an expected discharge date. They will be putting whether they need to be looking for placement, whatever. It will be all on this one page, and that will be visible to all the wards. It will be visible to social services, who are going to be providing the funding for the placement or the care at home if they're not self-funding. And the idea with this is to expand the transfer of Care Hub to all the people who would be looking after that person. So at some point in the future, they would then be looking at linking in GP surgeries, so that actually you can look at your patient's name and see what their journey through the hospital is. So this is something that's still being developed. It's still being looked at. I did ask last week how we're going with the GP surgery bit, and they basically said, right, well, we're getting the whole thing up and running and make sure it works, and then we'll move on to the part where we connect other people, carer support included. So we are hoping to have viewing rights. We don't want editing rights. We're just hoping to be able to see what's happening with that carer. When are they going to be discharged? Do they need any of our support, our onward referrals? So this is something, it's a case of watch this space, because say it doesn't start until November, but after they've got it up and running and it appears to be working okay, they will be increasing the people they're bringing in to be able to view what's happening to patients. It's sort of fallen behind by a month at the moment, because it was meant to kick off a wee bit sooner, but because what they're trying to do now is get that actual system in place where they are getting the safe discharge and they are being given the appropriate information, so that what they're saying is to avoid readmittance and to avoid the wrong people being sent home from hospital when they should really be staying there. They're starting the plan right from somebody coming into the hospital and following their journey through to what they feel will be an appropriate discharge.
Jo, I'm just that's been, I think, very informative for everybody, but I'm also aware, sorry Mike, of time.
Okay.
So I'm just wondering if we just take a couple of minutes for any other questions for Jo, but then I think we need to move on to Rachel and Mike.
Yeah, my apologies for taking so long.
I think it was very useful.
No, that's been so valuable, and I think, as for myself, even sort of working for Carers Support, sort of I know that the hospital team sort of is one of the sort of hardest working teams, because you get the complicated cases, so
yes,
some of the sort of trickiest situations. So I appreciate
our
what
situation
you do.
is that we're time relevant.
Yeah, but yeah, that's been amazing, sort of hearing everything that you do this morning, and I hope it's sort of been useful to everyone on this call.
Sarah's just asked a question in the chat about how many staff are in the hospital team these days.
a sore point. We were about 20 of us, and now we're down to 6 support workers and 2 coordinators.
Yeah.
Thank you.
Well, no, it's been brilliant. Thank you, Jo. I really appreciate your time.
Thank you. Am I okay to listen in to the next? It'd be very
Yeah.
interesting for me.
No problem.
Thank you.
Right, so the next part of this session will be myself chatting to Rachel from Lime Tree Surgery. And we're just going to have a discussion. We call it the spotlight surgery. So each time we have one of these sessions, we choose a particular surgery that's been doing a particular piece of work or done something. Particularly, it's a happy and sad moment today because Rachel's going to be moving on sort of from her role. So I'm a little bit gutted. Could you build up a rapport sort of with all the carers leads? So there's a couple of things I just wanted to sort of like talk about, and that's kind of timely, really. One of the things I will be discussing is just about having protocols sort of in place and sort of, you know, for this situation. So bear with me if I sort of ramble a little bit. There's no PowerPoint sort of presentation or anything like that. It's just us having a chat, basically. But one of the things I was going to talk about was the website, the Lime Tree sort of website, and sort of having that clear information on there for the carers. So I'm just going to sort of share that with you. And can everyone see that? Yeah. So what I do as part of my our role, and Caroline, who's not here today, is we do sort of go on to the websites, each of the surgeries, just to see sort of what's what's new on there, what any sort of news that's on there, and when we've done our baseline reviews, sort of like to see whether the carers support link has been added, and I just happened to sort of like come across sort of looking at the Lime Tree Surgery website, and it was really easy sort of to access sort of the information on there. So clicking from their homepage, they've got a clear button that actually sort of says about are you a carer, and it takes you through to this page. But one thing I liked on there, obviously they've got our link on there, which is sort of really important. But one of the things that I did like on there is the carer support policy that they have on there. I know not everyone's sort of been able to do that, and it's, you know, but it's something that I liked, and it might be something that you might take forward with your own surgeries. So, Rachel, looking at your website, I can see sort of the clear information and the policy and commitments of carers on there. Has this made a difference, having a named person and the information available in this format?
Yeah, completely. I mean, with the website as well, we had an actual specific IT in-house member of staff join us, so he was able to help me put this onto the website so that we could do it in a really clear way. But yeah, having the policy there, you know, it just makes everybody aware what they are eligible for.
Yeah.
I think the biggest thing, like you said, is that people just really like that they have somebody that they can contact, as in myself at the moment, to be able to arrange appointments, whether it's for themselves or for the cared for. They don't have to go through our reception system, which currently at the moment, we do have long waiting times. Sometimes you can be 50, 60, 70 in the queue in the mornings. So yeah, having the policy on here, just outlining everything we can offer them, I think it just reassures them that we are trying to do more for them as well, you know. Yeah. Not rather than, if we didn't put that on there, I think they might be just thinking, oh well, what is the, you know, what for, you know. So
And I really liked where you put on there, we will try and help you buy, sort of having that on there as well. So you're showing your commitment sort of to them, what you're going to try to sort of like to do for them. And it's very clear, isn't it, sort of for the carers sort of to see sort of on there. So yeah, I really like that sort of touch.
Yeah, like I said, I think the biggest feedback we get from carers is, oh, it's great just having that direct number for me to be able to liaise with me. Like I say to them, if I don't know the answer to them, I find out and I get back to them. So, you know, whatever their query is. So
I'll stop sharing the website.
No, it's okay.
I can see you. No problem. So by, you know, the small things, like having the website, it might be for a big thing really, because I'm not technical like that. I probably wouldn't be able to do it, but knowing that you can have someone sort of do that for you. Has there been an increase, would you say, in the numbers of carers registering or identifying themselves to staff as carers since you've sort of had that information available?
Oh, definitely. Yeah, since we've been putting it on the website, we've had lots more coming into us. I think on the digiboards as well, in our waiting rooms as well, that information, that screen that you had from yourselves from Carers Support West Sussex, well, that's on our digiboards as well. And yeah, it really has, because before it was just our notice board in the waiting room. You know, so having it on the website, obviously a lot of people, they do, don't they, nowadays they use the website to find out information, or even just to find our contact details, and then it's right there. So
no, it's brilliant. And do you feel our primary care project has helped in shaping the support that you're providing sort of to carers? You sort of by sort of working with myself and previously sort of with Julie or Caroline or Maxine, whoever, has that sort of helped?
yeah, massively. I think just having the information at your fingertips, like I said, being able to the resources that we have now available to put on the website or to put on our digiboards about identifying carers, or whether it's for the flu campaign or the COVID campaigns, that's really been helpful. And I think I think when we have the campaigns as well, that does identify a lot of carers, because they're looking for that information. They see, oh, I am a carer, I'm not registered, I can have that done.
Yeah,
that's where we get a lot more as well. So that's been really helpful. And like I said, just having that all the information that you've been giving to us, I really do feel like I've been able to identify more carers and get across to them, so to register with us and yourselves.
It is a bit of a sweet moment, sort of coming to the end of his sort of role. And like I said, I feel quite sad about it, but what would you say is sort of one of the most sort of proudest moments you've had sort of in this role?
Yeah, like you said, it's sad because it's not a role I want to give up. I don't want to leave it, but unfortunately, just because of changing hours due to children and school, I'm not able to carry on with it. But I think my biggest is, which makes me is so rewarding and proud, is the carers meetings that we hold. When I get to see our carers face to face and chat with them, and just get feedback, like we said, about just having somebody they can contact with the meetings, being able to come along and speak to other carers that are in similar situations, or they've been through more of a process. Obviously we have carers just starting as carers, some unfortunately ending their roles as carers, and they can chat to each other and just give each other advice. They can tell each other, oh, this is a good service to get in contact, or this support group, or they really do and enjoy meeting each other and being able to chat, and just being reassured that somebody else is going through what they're going through. So
I'd agree with you, and I've been to a couple of or several of the sort of meetings now, and there's always a really good turnout, and it's really lovely to see.
Yeah.
And I care. Sorry, after you.
So I was just going to say, is I think even, you know, now with this project and the toolkit, we've noticed identifying carers, because as you said, Mike, we can see the amount of people attending. It is growing each meeting we have. Yeah. We're getting more and more coming along to the meetings, which is fantastic. Yeah. And new carers as well, not just we've got our regular carers that come along, but we're getting more carers each time. So yeah,
I even had some carers bring back the stress balls that I gave them last time to say, thank you, I've used them, I don't want them anymore, you can have them back.
Oh, that's good, they don't need them.
I don't need them anymore. So that was kind of sweet. So with moving on, it's very important. One thing that we do sort of say to our carers leads is about having sort of protocols sort of in place, written down information, so that, you know, for this example, yourself moving on, that's something you have, isn't it? Something written down so that your job description, your role, how will you sort of use that for transferring that across sort of to your new sort of carers leads?
Yeah, so we have a protocol which I actually wrote up quite a few years ago, just to have in place. I think as well for, you know, for auditing purposes as well, which is obviously it's just great to have, because everything happens, you've got that somebody can take over, they can read it and know what needs to be done. So in it, you know, start off that we have a definition of a carer to make it clear who it is we're identifying. We do have as well how many carers we should have on our register roughly, which we do meet. It says we should roughly have 940 and we've got 850 odd, so you know, we I think we're for the numbers that we have in our surgery. And we've got on there about identifying carers, about using the notice boards, the digiboards, our new patient registration forms. They also have on there if you're a carer or if you're cared for. So that is a really big way of identifying patients coming into the surgery, because it's right there. Once they say they are a carer, I'll send out the information to them to register. It's got on there as well about reminding our clinicians. So every time we have a meeting as well, I always remind our clinicians to keep an eye out for people that aren't registered as carers. And in the protocol, we've got about when we receive a carer's registration form, coding it on our system so that we make sure they get their invites to our meetings. And so that it's clear for anyone accessing their records that they are a carer. We put on their home screen a message as well. So we do put on there, because there's a consent form as well, because some carers or some people that are being cared for do want their carers to have access to medical information on the records, others don't. So we do give them that option to fill in. So all of that is in the protocol, like not so much step by step, but an overall view of it. So, and the codes that we need to put on, and referring to yourselves at the end if they've asked us. So when I send out our information pack, we send out Carers Support West Sussex leaflet, so they can register themselves if they want, or on our form, they can tick a box and I refer for them. So, and then we've got your website on the end of our protocol so that we can refer if needs be.
It's brilliant, isn't it? And that is having that in place and having that as a handover as well for whoever sort of picks up and is able sort of like to carry on in that role.
That's right.
I'm not going to ask you any more questions. I was just going to say, is there anything sort of that you wanted to say, or are you quite happy with what we've sort of discussed?
Yeah, no, I've been happy with what I've discussed, and like we said, it's been a role for me that has progressed over the years. We started off just doing a one-to-one session with Maxine from Carers Support if they asked for it, and then through feedback from carers, they wanted more of a group session, and that's how sort of our carers meetings have evolved. And like I said, I think the biggest, you know, part for me, especially now, because before I did feel very much on my own and wasn't sure of different ways. to identify carers. And then when this, when this project and the toolkit came in, I do feel really supported by it. And it's been, like I said, having Maxine, having Mike, when Julie started as well, just having that contact, be able to ask, and like you said on the website, having the toolkit to access resources. It's really been, I think I feel supported by you, which helps obviously me then support carers.
No, that's amazing. And yourself and all the other carers lead sort of on the call, you are all doing an amazing job, and you're here because you want to learn more about how to support carers, and that's sort of really important that you are coming to these meetings. Rachel, there's a question from Jo. She says, it sounds such a good service, what you're providing. How many of the carers are asking for medical assistance versus coping assistance?
I'd say 90% are more coping than medical, especially obviously just I suppose when people first register, a lot of the time they will say, oh no, I'm fine, things are okay. And then when I initially make contact with them, and then maybe sort of a year or so down the line, or when things do change medically, they will come back to me and say, I'm now struggling to cope with this role. And they're the main phone calls that I get. So from people, it kind of comes, not every week, but some weeks I do have more phone calls where maybe people are ringing me for prescription queries, or especially just as Jo touched on with the discharge with the medication. I think it is confusing for them because a lot of the time they think, oh, some medication's been stopped, but it hasn't. It's just because the changes are noted. So I do get those calls now and again. But yeah, I'd say 90% are always going to be for emotional or coping support.
Any more questions from anyone else? No. Well, I just want to say thank you, Rachel, and thank you for your time. And I shall now hand you over to the lovely Anna.
Enjoying being called the lovely Anna. I'll just extend my name, that I am the lovely. I'll do my own introductions. Hello, I'm the lovely Anna. I'm from Carers Support West Sussex. Thank you, Mike, the lovely Mike. I just want to, based on what Rachel said, it's something obviously very important to us in the way that we've been developing relationships with you all, that there is quite a significant staff turnover in primary care, and people move on and carers lead roles move on. And from our point of view, it's so important that the good work that's been done by you isn't lost in that moment in time. And that's why I was really grateful that Mike and Rachel talked a bit about the carers protocol, because we hold that as almost like the gold standard of our foundation level support, because if you put that in place, people know their roles and responsibilities and they can transfer that to somebody new. So what I'm just going to do is I'm going to drop in the I'm going to quickly share, and then I'm going to drop in the chat. And we haven't asked Rachel, but maybe Rachel could consider whether or not she would make hers available for public consumption. But this link, which is where we talk about name a carer's lead on the toolkit, and we talk about an example role description for a carer's lead and some top tips. At the bottom, there's 2 example protocols. So one from Worthing Medical Group and one that we've written, a very simple one that you can literally just overlay the text. And obviously you need to get commitment from your practice manager to implement that. But just like Rachel said, it includes very simple things like who a carer is, how they can engage with the service, what the benefits of the service, like what a carer's offer might be, and the SNOMED coding, plus a few other bits. But it does mean that if you do move on within your organisation, that that the good work you've done passes on to your the person that takes over. So I have just popped that link in there. I always appreciate when Rachel speaks, because I'm the one that did most of the development around the toolkit, and I'm always relieved if anybody's using it, because I'm like, is it just out there in the ether, or is it actually useful and practical for people? So always a relief when I hear that somebody's using it. So do have a look around, but there's also just the link to that direct page. There's a couple of other things I just wanted to take the opportunity today to go through with you all. Again, Rachel just mentioned one of them. Let me get it up so I don't show you too much of my screen. Here we go. So this, we sent this out. Hopefully you can all see my screen. Mike, I can see you. Can you tell me if you can see my screen?
Yep, can see it.
Okay. So we sent this out last week. It's tricky because these file sizes, they get lost in people's inboxes or they get rejected. So we've had to look at ways of condensing the information, which might make it slightly trickier for you guys to use. So I just wanted to flag with you that we put together this free flu vaccination for carers campaign pack, and what you can use this menu at the top here. So what does the pack contain? It tells you about eligibility. It provides you with Facebook posts, digi-posters, suggested website text message template, an example letter or email, an all patients letter or email, the SNOMED codes to use, general digi-posters for Carers Support West Sussex, and kind of harps back to the wider support that you could offer. Each of those, because it is quite a big, you can see it's 11 pages, but each of those you can just click and it will take you to whichever part of the document. So you can just go to the part that's relevant or interesting for you. I just wanted to draw your attention to the eligibility for the flu vaccination this year, so you are all clear that the flu vaccination is available to the main carer for an older person, so that's with or without receiving carers allowance, the main carer of a disabled person with or without receiving carers allowance, a carer who does receive carers allowance, or rather ambiguously, if an individual lives with someone who has a weakened immune system. And that I've linked through to further information on that. But that is quite a significant cohort this year within the free flu vaccination for carers. So what we've done a bit further down is we have made all of that information available as both digi-posters and Facebook posts. Now, the reason I wanted to flag this with you is, one, because I know things get lost in people's email boxes, but also I think some people have found it a bit tricky where we've put it into the document in order to try and save on links and to save on, the size. So I'm just going to show you that if you right click on any document, it has the save as picture, and then you can just save that. And that means that will enable you to either use it as a PDF or as a JPEG, which means you can print it. If you want to put it on your notice board, you can include it in your digiboards. You can do whatever you want with it at that stage. So just they sit within this document because they make the file sizes smaller. And also because there's so much that we've actually put together for you, so you can use which ones you want rather than multiple attachments. But that's how you do it. You right click and you save as a picture. Within this also is some general on Carers Support West Sussex, simply because we're in the winter season, and you may find those that would like to engage with our services as well. And it also provides, last year we had 3 GP surgeries that we knew about. I'm sure many of you do it anyway, but 3 that we knew about do a specific identification campaign related to the flu vaccination. So you can do it on Accurex using a Florey questionnaire, or you can do it on MJOG. Obviously, there's a cost to the ICB, but there isn't a cost to you. And you do need to think about your character count because of that. But we found this hugely successful. Pound Hill actually identified 500 odd new carers as a result of this. Another surgery, Moatfield, I think it was over 100. And then it enabled them to offer those individuals, those patients, the flu vaccination, but it also automatically coded them onto the system so that it avoided that additional administrative effort. And it also, for for surgeries that are actually engaging with this project more kind of holistically, it enabled them to then think about what their wider offer for those carers could be. So if anyone wants to work with us on that, we would very much welcome a conversation with you. Obviously do it independently if you want to, but for all of this, whenever we put these things together, genuinely haven't got a clue whether or not anyone's using it. So please do let us know, because we do put time and effort into creating those, and it would be very, very helpful. Just a quick email that says we use this, or we did this, or we found this particularly helpful, because it means that we know whether or not it's a good use of our time. So if anyone hasn't received that, can you pop your emails into the chat if they would like to receive it again, and I will send individual ones so that we know whether or not we've got bounce backs on those. So if you haven't received it or haven't seen it and would like to receive it again, please pop your email addresses into the chat for me. And if you have seen it and are going to use it or do use it, please pop me an email and say we are going to use it, I promise, because that really helps as well. The other thing on this point that I wanted to mention is that this is the first, spring was the first round of COVID vaccinations where carers are no longer eligible in their own right. So that's a significant change, and clearly it does add to confusion for both carers and for us. It was confusing for us trying to get to the bottom or the root of that information, and so therefore I imagine it's confusing for carer leads and for GP surgeries as well. But carers, just for being a carer is no longer eligible for the COVID vaccination for this winter season. So just to make everybody aware of that. Okay. Then there was one other thing. Oh no, I tell you what else I want to do quickly, because we pulled this together for our commissioner. This is funded, as you know, all of you, by the Integrated Care Board, and it is currently only funded till April, and we are looking at sustainability options at the moment, and we do need your help with that, which I'll talk about in a moment. But also we were asked to put together just some headline project impact, and I just think it's worth sharing with you all, because and make sure you're seeing your name there. That's from what you did for us at the staff away day. But none of this has been possible without your engagement, and so obviously we're clearly very grateful for the way that you're working with us. But I also just think it shows that you're part of something that's actually making a fairly broad impact, and obviously that's very important to all of those carers involved. So we have had a 95% increase in our referrals since the project began compared to previously, and that's 919 carers that have been referred since April of last year, specifically from primary care. This is based on a small sample of 14 surgeries where we know that there's been over 1,100 carers newly identified to surgery, so they didn't know they were a carer previously. And in a survey, which some of you will have heard this before because this isn't new, this was at the end of year one, in a survey to carers where we had, I think it was 59 respondents, nearly 50% of them had noticed improvements in their GP, which I think is actually really powerful, because when we speak with carers, obviously they can be frustrated by what's not working. So to have noticed improvements, to see the glass half full is quite a big moment, I think. In terms of the GPs we've engaged with, 85 surgeries have engaged with this project since it began, and we include branches in those. 40 of you have completed a baseline review with us, which is fantastic, and we've seen improvements specifically from that engagement in 32 GP surgeries, and that ranges from small, medium and large. Any improvement we see as a great success. They've asked us to look at scalability, so we've included, the toolkit is scalable. It could be used across Sussex, it could be used more broadly. Similarly, digital resources could be used more broadly. And if you haven't already checked out our online primary care awareness training, we've had over 140 access it in just 3 months. It gets brilliant feedback. We are asking all surgeries to think about including that in their mandatory training for new induction and also for ongoing professional development. And then this talks about the building capacity is actually these networks. So we've had 58 surgeries engage in our practice networks and 87 professionals overall attend. And the reason we always ask you about your feedback at the end is because then it enables us to pop things like this together. And this is actually based on the first year because I couldn't collate the data that rapidly for the time frame I had for producing this, but 90% gained new knowledge about carers, 88% gained new ideas on how to identify and support carers, and 92% gained new knowledge about us and the support that we can provide you and carers. So thank you ever so much for being a part of that picture, and please continue to work with us. And this is where I have a couple of asks. So ask number one, we're exploring a piece of work which will be across West Sussex, which will be looking specifically at energy poverty, fuel poverty, and how that works both in the winter months and the summer months. Because in the winter months, obviously, it's about cold homes and, you know, when there's most imminent and pressing concerns around fuel poverty and vulnerable people being exposed to cold. But then also similarly, more and more so these days, we are subject to extreme weather conditions in the summer, and the heat poses its own issues around fatigue, heat exhaustion, dehydration, and how if you're going to keep your aircon on or if you're going to have fans, that will also equate to energy costs in the summer. So we are putting together or attempting to put together a piece of work around that at Carers Support West Sussex. And one element of that is around safe hubs or cozy hubs. We haven't quite determined what it would look like, but where we would meet every other week with any carers that wanted to engage with each other and receive some energy advice, but also have the opportunity just to feel safe in either a cool or a warm space. And we're looking at delivering that across the 7 districts of West Sussex, and whatever we can achieve free, we will always look to achieve. So I'm conscious that some of you do have big physical premises and some of you are increasing what your carers offer is. And if any of you would be interested in making a space available to us, it will also mean you have 2 wellbeing workers on site every, 2 to 6 weeks, whatever it looks like. Then please, could you pop, I don't want to get confused with the previous email addresses. So if you could pop cozy and your email address, I would love to follow up a conversation with you about whether or not we could engage with you on some of that work. So that would be fabulous. And we know that a lot of particularly our older and vulnerable carers, are going to really benefit from experiencing a service like that. And it will also include things like physical distribution of packs, so winter blankets or heated blankets, fuel vouchers, so very tangible direct support that can immediately address the issues that carers will be experiencing if we're successful. Petra, Joe, what do you think, we care? But anyway, brilliant. Anyone that would be willing to have that conversation with us, please do pop something in the chat to have a chat with me. Okay, and then thank you, everybody. Always appreciate willing people. Thank you. It's fantastic. And lastly, so Mike, we've got a mix today of social prescribers on this call and carer leads, and we'd like to ask you both something. So at the end of every session, we do a poll, and that poll just asks exactly those things that enable us to say you've gained knowledge, etc., and to lift that up. But what we really, really need from those that have any influence within their local surgery around making changes, so any carer leads that are on the call, or any social prescribers that actually implement this type of support and services, we are putting together a sustainability plan at the moment for how we might be able to continue this work going forward. And being able to evidence impact is what obviously helps us prove the argument for why we think it's important that these kind of conversations can continue. So this only takes, we haven't asked for any data this time because we know that takes longer to put together. So this should only take like maximum 5 minutes. But anyone that is a carers lead, or anyone that has implemented changes within their surgery or has scope to, I'm going to pop in that is not it, because I have since copied something else. Let me just get it again. I popped it to you, didn't I, this morning, Mike, so that I could copy it again. Hold a sec. Here we go. Okay. Oh, where am I now? I've lost myself. Here I am. Okay. So if you click onto this link, it will literally only take you 3 minutes maybe, but if you could fill that in, that would be thanks. If you could check, Valerie, if you do have time, just on that forms, perhaps later in the day, I'd be super grateful. But it will literally take you a couple of minutes, if you're willing to. That is our primary focus of today, is to get any feedback on how you've experienced the project, or if you've made any improvements in your surgery. So that would be invaluable. Please, please, please do click on that link and fill it in. For those of you that want to do our poll in addition, or for those of you that do not have that kind of influence or engagement with specifically within a GP surgery. Oh, Jamila's rather late. Then Mike will launch the poll now. Jamila, I think you've just joined us, but we're actually finishing at the moment. So if you want to connect with us separately or have a chat, please do let us know. So for those of you that do have created any changes or have that scope, please fill in the forms. And Mike, if you go ahead and launch the separate poll now, which please remember, this is less important to us on this particular occasion because we would like you to do the forms mostly, then please do that. And thank you everybody for joining us today. And Mike, I'll hand back to you to say the final thank yous, as Mike's done a lovely job. Well done, Mike, of bringing us all together today.
Well, I've just launched the other poll. Well, I think I have. Something's come up on my screen. Has it come up for everyone else?
It doesn't have any questions, actually.
Oh.
It's just got a tick and a cross.
Why has it not done it then? Try that. Ta-da!
Yeah,
that's
better?
It.
Now it's worked. Yeah,
that's
great.
Better. Okay.
Yeah.
So just to say a big thank you to everyone for coming along to today's session. Thank you to Joe for all the information that you shared with us, and thank you to Rachel, and thank you again to the lovely Anna for the information. We're hoping the next joint session of the Carers Learning Set and the Carers League Network meeting will be the 6th of November, but we will send in an email out to confirm that. And if you've got any ideas of any guest speakers or anything that you'd be interested in, please let us know, because we're always willing to sort of look at subjects that you're interested in. So once you've completed the poll, if you're happy to complete the poll, I'll say goodbye to you. I'll stop recording.
And actually, just Mike's just said there, the 6th of November, and Carers Rights Day this year, because I know many of you do take action on that day, is the 21st of November. So we will put together some of the information and posters for that, and we'll share that at the next gathering as well, in case you want them in your surgery. Thanks, everybody.
Thanks a lot.